What if I told you that there are around 70% people in our country who are roaming around with some stage of gum disease in their mouth? The sad part is that the majority of these people are even not aware that they have this in their mouth. And the creepy part is that you could be one of those people. Hello and welcome, ladies and gentlemen. I'm Dr. Herlene Gill, back again with a fantabulous video for you. Yes, it's going to be about gum disease. And if you're new to my channel, then please consider subscribing and also hit the bell icon so that you do not miss any of my videos. Now, what exactly is gum disease? I'll help you to understand that with the help of my beautiful diagrams and with my jaws, not my jaws, but the jaws that I always use to help you guys understand dentistry a bit more in detail. So when you look into your mouth, what you see is just the crowns of your teeth. You don't see the roots of the teeth because they are within the jawbone. And the jawbone is covered by the gum or the gingiva. But the gingiva is very firmly attached to the jawbone. And if you look very closely at this junction between the gingiva and the teeth, look at this junction where the gum and the teeth meet. Here, the gum is not stuck onto the teeth, but it just sits very delicately like this over the teeth. And there's a V-shaped kind of a valley or a space between the gum, between the gingiva and the tooth. So this is the tooth, the crown of the tooth, and the root, the bone, and the pink part, the red part is the gingiva. Now if you look very closely, there's a little bit of space between the tooth and the gingiva here. This is known as the sulcus. The V-shaped valley that's created here is the sulcus. Now, what's the significance of the sulcus and why am I telling you about it? It's because it is here that it's a very, very secluded and protected area. And the bacteria, these are the bacteria, and we already know that there's so many bacteria in the mouth that they're always trying to invade this little space that is secluded because they are always looking out for a place where they're not disturbed by the toothbrush, by the floss, or by the any other cleaning agents that you may be using, a mouthwash perhaps. So it's a very, very protected area. But nature also makes sure that these bacteria are not able to gain access into this area. How? It has this sulcular fluid flowing into it. So the fluid has a cleansing effect. Any bacteria that do gain any access here, they get flushed out because of the flowing fluid. And there are also immune proteins and antibodies here that make sure that any bacteria that are left behind can be destroyed or easily destroyed and killed. So this creates a delicate balance or an equilibrium between the bacteria and the body or the immune system of the body. But there are instances where this equilibrium gets disturbed. This whole equilibrium is normally seen in a healthy mouth. But if the immunity of the body dips down because of disease or these bacteria, they become too toxic or their virulency increases, that's where things start getting muckier or that is a very sticky situation. In that situation, the bacteria then start gaining access over this region or into the sulcus. They try to enter the sulcus. But before that, they start piling up over here near the neck of the teeth. And if you're not cleaning your teeth properly, they will start accumulating. So bacteria keep on piling up on each other here. They'll keep stacking over each other and form a very sticky kind of a creamish film, which is known as plaque. Some of you may be aware of plaque. So that's how plaque forms. And slowly, because the immunity of the body is not good enough, what happens? These bacteria that starts entering into the sulcus, accumulating over time. And if you're not cleaning this plaque away or cleaning it off the teeth, this plaque layer has bacteria in it, and these bacteria, they start secreting a lot of toxins and chemicals as their byproducts, and those byproducts starts irritating the gum or the gingiva that is just next to that area, and as a result of that irritation, the gums become inflamed, so they become very inflamed. Now inflammation leads to increased fluids, fluids to accumulate in the gum, and as a result of that there is bogginess in the gums, and inflammation also increases the blood supply in the gingiva. That leads to the gum getting easily they get irritated by the toothbrush, or when you bite into an apple or have something hard to eat, it's going to cause bleeding of the gums, and most of the people are aware of that as well. But you will also see that the gums look very red in color. All these symptoms are symptoms of early gum disease, which is known as gingivitis. So gingi means gingiva, vitis means inflammation. So when there is inflammation of the gingiva, that is the initial stage of gum disease, and it is very, very easy to treat it. The first thing you have to do is learn or relearn, I'd say, how to brush properly. I've already made a video about toothbrushing, effective toothbrushing, and if you want to watch it, you haven't still watched it, you'll find the link in the description box. Please go and help yourself. So the first thing is how to brush. If you brush, that means if you brush properly and effectively, you get rid of that plaque. If you get rid of the plaque, it means the bacteria are destroyed, and that will slowly bring the gum back to the healthy state. But that doesn't mean you don't go and check it out, get this problem checked out by the dentist. You have to visit your dentist, because in most of the cases the plaque is very, very tenacious, or is stuck so firmly to the teeth that it's very difficult for the toothbrush to remove it. So that's where the dentist is going to scale that plaque away. That's what scaling does. So you have to get your teeth scaled, and you also have to brush properly, learn how to brush effectively, so that you do not allow this plaque to accumulate. Now, the second stage of the disease is more dangerous, and it causes a lot of more destruction in the structures around the teeth. How? Because if that plaque is not controlled, or you fail to visit the dentist, what's going to happen is this plaque or the bacteria, they keep on accumulating. There's no time for them to stop. They will not stop at any stage. So over a period of time, this layer of plaque, or this big colony of plaque, will keep on getting bigger and bigger, and it keeps going deeper and deeper into the sulcus. So this was the sulcus we were talking about. It goes right till the bottom or the end of the sulcus, and it keeps on irritating the gum there, and eventually what happens, that because it goes right at the bottom of the sulcus gets deeper and deeper, because the gum keeps on parting away from the tooth. So this V-shaped structure that I was talking about, it becomes more and more deeper. It becomes deeper and deeper and deeper and deeper. So the deeper it gets, it means that the gum disease is advancing and getting worse over time. And the bad part is that there's no way that you can keep this deep structure, which is known as the pocket, clean. You cannot clean inside the pocket, because the bristles of the toothbrush will never enter that far, and there's no other instrument or any other thing that can go in there except a scale or tip, which is used by the dentist. So what's happening here? You can see that the bacteria are accumulating to the extent that they have deepened the pocket. Apart from that, there's still going to be a lot of inflammation in the gums. They're going to bleed, they're going to look boggy, spongy, and the bone, which is just underneath the gum, it starts getting destroyed. It starts getting damaged because of the toxins of the bacteria. Now, as the bacteria go downwards, they're also going to affect the bone. So And because the gum is sitting right over the bone and the bone is getting destroyed, so the bone level reduces, and what happens to the gum? That also recedes. So when the gum recedes, now this is what's happening, the gum goes down, so it's receding down. It recedes like this, and this portion of the tooth is going to be exposed to the oral environment. Once that, with this region of the tooth is exposed, that is the root part of the tooth is exposed to the oral environment, sensitivity sets in. Now I have already made another video all about sensitivity, and I have included it in the description box today, down below. So please go and check it out if you haven't watched it yet. Now this sensitivity is going to cause a lot of problems. Apart from the sensitivity, there are other symptoms like bad breath, which is known as halitosis. Some people see that their teeth have moved around. That's because when the bone levels go down, and you can see that the bone anchors the tooth or the teeth. So when the bone levels go down, the teeth become more wobbly. And if this disease is not checked, ultimately you will end up losing your teeth. Your teeth will become more and more mobile, more and more wobbly over time, and a stage will come when there isn't adequate bone to hold those teeth and they will fall out. This stage of the disease where the pockets start forming, that is known as periodontitis. So that is a very severe form of gum disease. Now, one thing you need to remember is not all the people are going to have the severe form of the disease. Some people might just have gingivitis, but only some people are prone to periodontitis. So all the people who have gingivitis may not have periodontitis, but all the people who have periodontitis, definitely they'll have gingivitis, which was inflammation in the gum. You will definitely see that. So if you don't want your teeth to fall off like this because of gum disease, please go and get your treatment done from your dentist. So what's the dentist going to do if you have periodontitis? He is again going to do the scaling of the teeth. Now it's going to be a rigorous regime that has to be followed. Maybe you might be referred to a gum specialist. Now because there is going to be destruction of the gum as well as of the bone, teeth are going to move around. There are going to be so many aesthetic problems in your mouth. They might need to be fixed with the help of surgeries later on. So now you can understand how dangerous this problem is if it is not fixed or picked up and treated on time. Thing to remember is, another thing that you need to keep in mind is that the damage that has been done because of the gum disease, the damage to the gums or to the bone cannot be reversed. But the latest research shows that if lasers are used, now some dentists do have those particular lasers, they use those lasers to induce the growth of bone, and some studies have shown very good results. So, but again, look at the price that you will be paying for all this. So why not go and get things checked out by your dentist? A very special tip now. Your health also depends upon this gum disease, which means that if you, as I just mentioned earlier in the video, that if there is some sort of disease in your body, that is definitely going to encourage gum disease in your mouth as well. Particularly people who have diabetes. If you are a diabetic, you need to control your blood sugar levels and also make sure that you get your teeth cleaned at least 3 to 6 months. Every 6 months or every 3 months. Check it out. Get it checked out from your dentist how often you're supposed to go and visit them. Why? Why am I emphasizing this? It's because if you are diabetic, there's going to be increased blood sugar level if your diabetes is not under control. Now, too much sugar for the bacteria is heaven for them. They love that environment. So there's going to be more proliferation of these bacteria, and there's going to be more extensive damage in your mouth. And be careful that periodontitis is one of the complications in a diabetic patient. So if your blood sugar levels are not controlled, you will end up having periodontal disease in your mouth. Now, this forms a very vicious cycle. If your diabetes is uncontrolled, you're going to have periodontal disease, and periodontal disease also makes sure that your diabetes doesn't get controlled. So this forms a vicious cycle that needs to be broken. So how do you break it? You go to the dentist to get that bacteria removed, the plaque removed, and you also go to your endocrinologist to get your diabetes under control. So if both of these things are controlled or under control, you won't have any problems. So coming back to periodontal disease, or the severe stage of the gum disease, is that this is not very easy to control. There could be some areas around each tooth or certain teeth which may need lifelong maintenance. And if you have gum disease once, that means, and if you get cured, there's a high likelihood that you may have it again in your life. So it's very, very important for you to maintain your oral hygiene over a period of time, or for the rest of your life. Very, very important. So keep these things in mind. If you have any questions or you have any other queries, then please let me know in the comments below. But please do comment as to how you like my videos. Do you want me to talk about something that you are having issues with? I'm more than happy to help you. And once again, I'm Dr. Harleen Gill, signing off.